start today. Thank you for joining us and welcome to Better Together Live, where we create helpful community connections when it matters the most. I am Jamila Bowman, your host and the Community Relations Coordinator here at TherapyWorks. Today, I'm happy to be joined by Victoria Veneziano from Discovery Mood and Anxiety. Welcome, Victoria.
Thank you so much. I'm excited to be here.
I'm happy to have you. So we started Better Together Live to highlight local resources like Discovery Mood and Anxiety to offer access for our local community. I'm very, very happy you're here. So please tell us a bit about yourself and Discovery Mood and Anxiety.
Absolutely. So I've been with Discovery Mood and Anxiety for just about 2 years now, and we are one branch of an umbrella organization called Discovery Behavioral.
That's right. Yeah.
Right. And the mood and anxiety, as it implies, is our mental health primary branch. Separate from our primary branch, that's mental health, we have our eating disorder division and a substance use division. Locally in the Bay Area, our treatment for mental health is in residential care. Our treatment for eating disorder is both residential and outpatient care.
Okay.
So Discovery Mood and Anxiety, particularly, the reason I was drawn to it is because we're really small milieux in beautiful, warm, and loving homes that is very conducive to the lifestyle that our patients will be living in. So it's not a hospital feeling.
That's right. Yeah, and that makes a big difference.
Huge difference, right?
Yeah,
they have to be able to function in the environment that they're going to be living in. Mm-hmm. And on that same account, while we're not a hospital, we're also not an isolated retreat, right? There aren't servants and maids and things like that. So you're really committing to learning how to function in a life that is more parallel to what you're living in.
Okay, so let's talk a little bit about the residential.
Sure.
What is the program? How many weeks are you guys have boys and girls together? How many beds you have? Talk to me a little bit about that.
Great questions. So one of the things that's wonderful about Discovery as an organization is we're gender inclusive across the board, gender affirmative. And what that means is whatever gender our patient identifies as. So gender affirming what they are identifying as. We have different programs, specifically here in the Bay, to help where they're going to be most comfortable and feel safest. Mm-hmm. So we have one of our homes in Brentwood is all female identifying.
I see. Okay.
And then one of the homes is gender inclusive, so that if you don't identify as male or female, you don't have to choose. Does that make sense?
It makes sense.
Yeah.
That's wonderful.
So both houses are beautiful in their own account. They're about 1.5 miles from each other. And they are both 6-bed. So super small, super intimate, super familial. And we do have another thing that's really cool about Discovery as an organization is we are health at every size, which means we have beds and furniture to accommodate bodies of all sizes. So that's something I like to point out because while you do share a room, 2 to a room, we do have separate bedrooms, and we also have different size beds.
Right, which is, you don't think about the stuff like that, but it matters when people need it, right?
It does.
So this is it's kind of like a silly question, but I have to ask. How you guys fix if somebody doesn't like the roommate you're with? You guys work it out together? Is a therapist involved in the whole interaction with them? How you fix that?
Well, our care in the Bay is for adolescents, so chances are they're probably not going to like their roommate.
Correct.
That is a big part of the therapy in motion, right? We'll sit in treatment team, and often it's very intentional from what people are working on in their own therapy to be paired with that roommate so that they can practice the skills that they are trying to, de-escalation, the DBT skills that they're learning in-house are meant to. So while there'll be a conversation around it, there's not going to be roommate requests. Sometimes there are roommate requests, and then we know maybe we need to not have those two together.
Right.
There's a lot that goes into it.
I know. Yeah, I can tell.
Yeah.
how about the eating disorders? What is the program? Can you explain a little bit the program for eating disorders? Because
Sure.
I mean, we are having more and more, especially in young girls, but
Yes.
also we've seen boys with
Yes.
eating disorders and adults. Can you talk a little bit about this, please?
You know, it's really interesting what I've learned since joining Discovery about the eating disorder world that I didn't know. And it's fascinating to me that binge eating disorder accommodates for a third of all eating disorders. And it's one of the programs that we are most proud of, our Path to Peace, to address the binge eating because it is so underserved, right? People who don't look like they have an eating disorder, which is something that our organization is really committed to destigmatizing, because we look at how you're treated differently and it being in a larger body as a social justice issue. To speak to your question specifically here in the Bay, we have 3 different residentials. We have 2 that are adolescent, again, 6-bed, small. And then we have 1 that is adult identifying female. As far as male treatment, we do have programs that aren't local to the Bay that are gender affirmative for males. But in our outpatient program, so our IOP PHP that's in the East Bay, that's all genders and all ages. Of course, our programs are split so that they're not all together. But to make sure that we are addressing that, just what you said, that while it seems like a young female problem, it's not.
It's not.
It's more hidden.
It is crazy because probably, adults, they came up with that problem later in life. It was undiagnosed for so long that, unfortunately, I do have people that I know that they having this problem. They are in their 40s.
Right.
They didn't have that before. They were not diagnosed with that problem. So do you guys have mixed older adults, women with teenage women? How is that?
There's been some really interesting relationships formed as far as mentors and kind of looking at how, I shouldn't say mentors, but alumni rather, that have come back and shared what their experience has been and how recovery is, continuous, right? It's something that you're always working through, but you can get to the other side. And then you can see some of the younger patients look up in real hope, which is really promising. But no, we do make sure that it's age appropriate and age distinct. And the other thing I should mention, that in all of our programs that I feel very fortunate to have witnessed and to be invited to be a part of, is the family component.
That would be,
sitting around the table, doing the psychoeducation, understanding that this eating disorder demon that lives inside has this voice that's talking to them and running the show a lot, and what it really is underneath. And because we're all evidence-based treatment and very trauma-informed forward, we really understand that the eating disorder coexists with the other diagnosis.
Wow. You explained it so well. Thank you. That was great. So
you all do a lot of work with involving the family, because your work.
We do. And I think it's very, very important in order for our client to succeed. The family needs to be involved in every step of the way. It's just the way it is. Whether it's eating disorder, whether it's anxiety, depression, and sometimes all of it. Right? So the family needs to be involved.
And it's so cool to see what happens for the families too, what they can do around their own work.
Correct.
And the adolescents and the adults really enjoy seeing that their family has homework, has work to do for themselves. So it's no longer I'm the problem, I'm the issue, but it's how can we all change how we relate to one another.
Correct.
Yeah.
Yes, for sure.
That
was great. It is harmony, right? I mean, I can see some families can get a little defensive, right? Because we're normal. I mean, we're humans, and that's a normal feeling, right? That hold on, my son is going through this, but I did my best, right? And I'm sure a lot of families feel this way at first, but then I think with the right program like you guys, everybody gets into understanding, and it works great for the family, for the kid, for the client, right?
Absolutely. I mean, we all start to realize in our own work how we relate to one another's and how we can
True.
change things if we want change to happen.
Correct. Wow.
Yeah.
I like that.
Yeah.
It is nice. So I have a question. What is the thing that might surprise us about discovery, mood, and anxiety?
Something that might surprise you. Well, just that each program is very, I use the word familial. And I always think about it like we are a big extended family, but each house has its own flavor, its own warmth, really because of the staff that's there. So they bring their own joys, their own passion. And so that's a little surprising that it's not cookie cutter, not sterile. I mean, you might go to the Brentwood One house and Natalie, one of our therapists, was a former tennis pro and loves sharing that as they're, hitting some balls. What did that feel like? All of those. And another house has a really unique kind of spiritual vibe because of their program director. So I think the surprising part can be that while we have this foundation of supportive programming, everything scheduled, structure, involvement with making your meals, all foods fit, all of these things that are in place as the framework. And then the delivery and the flavor is so unique at each house.
And I love that. I mean, that's how people probably feel way more comfortable, right? And like you say, I was checking on your website and you see the person and not the disease, right? And I think part of what you guys do is that, because you implement all that. Right. So that's very powerful.
And we have to take into account too, that when you have different environments, right? Like the Bay Area, you have different resources and the environment is part of your teacher. So our kiddos in Long Beach are going surfing all the time. Our kids here, equine therapy, or using the environment that they're in as part of the treatment.
Part of the treatment, yeah.
Yeah.
Wow.
So that's fun.
That is fun. Do you guys use animals for therapy? Horses and dogs. I mean, I heard and I read about some, I don't know, not specifically you guys, Discovery, but some people do that. Would you?
Do you have animals yourself?
I have a dog, but we don't, yeah.
I don't know. I think he gives me more anxiety than.
Yeah.
I'm like, what are you doing now? But no. Yes and no, the answer to your question again. So house to house is going to be a little bit different. We have had service animals. We have had funny things like at our IOPs, we've had bunnies and things brought in. But then, you have the flip side of that too. That can be that can be very triggering. But one of the things that we do use is exposure therapy, whether it's in eating disorder for a specific food that might be your binge food, sitting with an Oreo. I just chose an Oreo because that's my go-to.
Don't forget the milk.
That's what I'm thinking of right now. Yes, exactly.
Right.
Glass ice cold milk. Or maybe shopping gives you anxiety. You're not comfortable in your body yet. The use of exposure therapy, whether it's with animals, or with social situations, I think that is more of our approach, is really integrating exposure response therapy into the treatment
That's great.
modalities. Yeah.
That's really good. That's really good. So I can see you're very passionate in working in there and with the job you do. What do you like best about working at Discovery? What's your, your heart?
Immediately, there's a lot of things that I really appreciate, but immediately where my heart went, I pictured the staff and the teams that are in the homes. So our primary therapists at each home, our program directors, if it's regional, all of our counselors. There's something, as you know, from being in this work that is just so warm and inviting and accepting. And what I like best is I'm out in the field so often. It can be, that I'm there every week, or it could be that I haven't been there in a month, and I am greeted and received with such love that I know that our patients are receiving too.
Oh,
And that's
sure.
really, that helps me sleep at night, because I know that the people in the homes are so warm and loving and doing everything they can to work with insurance. That's something that's really special too. We're very accessible through insurance. They're doing everything that they can to fight for the patients to be there appropriately, which
Right.
is helps me sleep soundly. I sleep well.
That's good. You're doing a great job, for sure. So what is
Yeah.
one of your favorite community resources out there?
That's a great question. You know, I've been thinking about that, because as you know, in the Bay Area, we all collaborate so harmoniously, which is something
I love that. Yes.
I hugely appreciate. And I have to say, because we only have residential treatment for the mental health, line, while we do have an IOP PHP for the eating disorder division, my most trusted resources are organizations like TherapyWorks and
Thank
other
you.
IOP PHP programs that we rely on heavily to step down into.
Right.
And while we appreciate the hospital programs as well, we are really committed to breaking the hospitalization cycle. So having these warm wraparound community services and seeing that they're emerging now with a more holistic approach is really what I'm proud of, to be able to hand over and to say to families, because we don't have this full continuum of care up here, and we know that we don't need to recreate the real, because we have so many good resources that are going to keep you and your family wrapped in treatment.
Right.
Yeah.
That was perfect. I love it. This is really, really helpful. All this information you're giving us. Thank you so much. And I want to be very respectful with your time. Is there anything else you would like to add? Maybe your information, your web,
So
email address, phone.
Fabulous. Yes. Anybody who's interested in learning more, our website is discoverymood, mood.com. You can pop on there. There's virtual tours, so you can see the different flavors, like I was speaking of, different locations. My name is Victoria. I'm here in the Bay. If I'm always open to talk to anyone. The website, we all can look online, but please do feel free to call me. 925-353-5983. You can text me, you can call me, you can leave messages. It's confidential. I obviously like talking, so I'm here and I'm happy to help.
Thank you so much. And as for us, our philosophy here at TherapyWorks is we are better together. Everything we do is to support our community and people just like us, like you. And we understand sometimes reaching out for help isn't always easy. But we're here if you need us. To learn more, visit us at mytherapyworks.com or give us a call at 408-508-6789. Victoria, it was a pleasure to have you.
Oh,
thank you so much.
Thank you for all your love and support.
Oh,
we're so glad
always. We love you guys. And if you want to come back for another interview, please go ahead.
Thank you.
Yes,
if anything comes up, let me know.
Yeah. And what are you going to do now for fun? What do you do?
What do I do
question.
For fun?
Yeah, to relax.
I dance a lot. I yoga. I walk.
Yeah. Nice. Yeah, me too. All right.
I'll see you soon.
I'll see you soon.